The call hit the OR intercom at 11:14 on a Tuesday morning. Not the middle of the night. Not the witching hour that people always imagine when they picture hospitals falling apart. Just an ordinary Tuesday gray sky outside the windows, half-eaten breakfast trays still in the hallway, the vending machine on the third floor, making that grinding noise it had been making for 6 weeks because nobody had filed the maintenance request correctly. 11:14. And Ward 7 of Callaway Regional Medical Center stopped breathing. The patient's name was Frank Dempsey, 61 years old, retired firefighter, grandfather of 4, the kind of man who called his daughters every Sunday morning and always remembered birthdays. He had come in for a scheduled hepatic resection, a removal of a section of liver, damaged by a benign tumor that had shown up on a scan 3 months prior. Routine, his surgeon had told him, manageable. You'll be back to gardening by spring. He was on the table, chest open, anesthesia holding steady when the bleeder appeared. Not a small one, not the kind that responds to pressure and patience. A severed branch of the hepatic artery, deep and catastrophic, pumping blood into the surgical field faster than the suction could clear it. Dr. Raymond Stokes, the attending hepatobiliary surgeon, had 22 years of experience and a reputation that stretched 3 counties in every direction. He was technically excellent. He had never lost a patient on a table in his career. He froze. It happened in a fraction of a second, and it happened completely. The kind of freeze that isn't visible from the outside until you know what to look for. The hands that don't move, the eyes that go slightly unfocused, the body that is still standing in the room, while the mind takes 1 step back from what it is seeing. 3 seconds. Maybe 4. In a normal situation, 3 seconds is nothing. In a hepatic artery bleed of that severity, 3 seconds is the difference between correctable and irreversible. The 2 residents at the table looked at Stokes, then at each other, then at the field where blood was rising, and then Nora Elspeth Voss, who had been standing at the instrument table on the left side of the OR, doing exactly what the OR schedule said she should be doing, which was managing the sterile field as a scrub technician moved. Not frantically, not in the way people move in disaster, which is usually too fast and too imprecise to be useful. She moved with the economy of someone who had done the next thing she was about to do before. In conditions that made this OR look like a spa, she crossed to the field, called for a vascular clamp without raising her voice, received it from the circulating nurse who handed it over more by reflex than by conscious decision, and placed it with a precision that stopped the bleed in one motion. One motion. The monitor stabilized. Blood pressure, which had been plummeting, found a floor and held. Nobody spoke. Stokes came back into himself about 2 seconds after the clamp landed. He looked at the field. He looked at the clamp. He looked at the woman who had placed it. This woman, he knew as a scrub tech 3rd year at Callaway Regional. The kind of person whose name he knew in the abstract because it appeared on the OR schedule, and occasionally on incident reports. When she flagged something the residents had missed, and they turned out to be wrong, and she turned out to be right. What? He said. And it was not quite a sentence. Nora did not look up from the field. Vascular repair kit, she said to the circulator, in the same even tone she might use to ask for a cup of coffee. 7-0 Proline. And I need Stokes back with me, please. Right now. The please was not politeness. It was precision. It was the word of someone who understood that the person she needed had just experienced a neurological interruption and required a redirect, not a confrontation. Stokes stepped back to the table. Walk with me, she said quietly, and she guided him through the repair, not performing it herself, narrating it, placing instruments, anticipating his next move by half seconds in a way that made it look like collaboration, like she was just there to assist, like the initiative was his. She did this deliberately. She did it with a level of situational intelligence that nobody in that room had the presence of mind to name in the moment, but that several of them would lie awake thinking about later. The repair held. Frank Dempsey's blood pressure climbed back to a number that meant he was going to be alive to call his daughters on Sunday. The tumor section was completed. The chest was closed. When it was over, when the patient had been wheeled to recovery, and the team had begun to peel off gloves and masks, and the specific adrenaline of a crisis that had resolved, Stokes stood at the scrub sink for a long moment before he turned the water on. Then he said to no one in particular, "Who is she?" One of the residents, a second-year named Dr. Timothy Holt, opened his mouth and then closed it again, because he realized he didn't know the answer in any way that felt adequate. Scrub tech, he said finally. Nora. She's been on 7 for a while. Stokes nodded once very slowly in the way of a man filing something away. He did not sleep well that night. He was back in the hospital at 6 the next morning, which was not unusual for him. What was unusual was that instead of going directly to his office, he went to the nursing station on the 3rd floor and asked the charge nurse on duty, a woman named Helen Park who had been at Callaway for 19 years and had a specific expression she reserved for situations she found professionally unusual, where he could find Nora Voss's personnel file. Helen's expression appeared. "I can pull it for you, Dr. Stokes," she said carefully. "Is everything all right?" "Fine," he said. "I just want to review it," because he had not yet decided to sit down. The file was not long. That was the first thing he noticed. Nora Fossa, Yora Foss, 34 years old. Certified surgical technol. Previous employment history that listed only a single line. United States Army, 2013 to 2021. 8 years. The reason for separation listed as honorable discharge. Stokes read it twice. Then he called the credentialing office and asked if there was supplemental military documentation on file for Nora Voss. There was a pause on the other end of the line. "There is a file," the woman at the credentialing office said carefully, "but some of it is restricted. I can send you what's not." What came through 20 minutes later was partially redacted, which Stokes had not been expecting. He had expected the kind of military service record that showed up behind a lot of healthcare workers from that era. Combat medic training, some field experience, maybe a commendation. What he received was a document with multiple sections blacked out, a classification header that he had to read 3 times before he accepted what it meant, and a single unrestricted paragraph that listed her primary MOS as 18D. Special Forces Medical Sergeant. Not combat medic, not even the Advanced Combat Medic program that some people confused with this. Special Forces Medical Sergeant. A pipeline so demanding that it made medical school look well-paced. 18 months of instruction that covered everything from trauma surgery to emergency dentistry to veterinary medicine, because it is in the field. The SF medic was the surgeon, the anesthesiologist, the pharmacist, the recovery room, and sometimes the morgue. They operated in 12-man teams in places where the nearest hospital was an abstraction. They performed surgical procedures under fire, with headlamps, with instruments packed into a bag they carried on their back. There was a commendation in the file. The specifics of what it was for had been redacted. The language, that remained said only, demonstrated exceptional clinical judgment under conditions of extreme operational stress, resulting in the preservation of life, where loss was considered inevitable. Stokes set the file down on his desk. He sat down, he thought about the clamp 1 motion, the economy of it, the absolute absence of hesitation. The way her hands had moved like the crisis in front of her was a problem she had already solved several times in conditions he couldn't quite imagine, and didn't entirely want to. He thought about the way she had guided him back into the procedure, without making him feel guided. The precision of that, the care in it. He thought about the fact that she had been on this floor for 3 years, working as a scrub tech, managing instrument trays and sterile fields and the logistics of other people's surgeries, and that nobody, as far as he could determine, had looked at her file. He thought about that for a while. Nora Voss was in the instrument processing room when Stokes came to find her, not the OR, not a patient room, not a place that people of his seniority typically appeared. She was running decontamination on a tray of laparoscopic instruments, methodical, focused, doing exactly what the shift schedule said she should be doing. The room smelled of enzymatic cleaner, and the faint metallic warmth of the autoclave running its cycle in the back corner. She heard the door and looked up. She clocked the absence of residents behind him, the absence of the department head's assistant, who usually preceded him into rooms to announce things. She noted that he was not wearing his OR clogs, which meant he had come from his office, not from a procedure. She noted all of this in the time it took him to cross the room, because that was how she had been trained to process entrances, as data, as signals, as things that told you whether what was coming through the door was a problem or a conversation. This was a conversation. She turned back to the tray and kept working. "Voss," he said. "Dr. Stokes," she said. He stopped a few feet away and looked at her for a moment. Not in the appraising way that some of the attendings used, the kind of look that measured and categorized. In the uncertain way of a man who had come with a specific plan and found on arrival that the plan no longer quite fit the situation. I read your file, he said. I know, she said. He waited, because he had expected something more, and she did not offer it. She finished wiping down the instrument, set it in the tray, reached for the next one. Why are you here, he said. And then realizing it had come out wrong. Not here as in this room. Here as in this hospital, this position. She set the instrument down and looked at him directly for the first time since he had entered. I needed somewhere clean, she said. He didn't answer immediately. That's not a metaphor, she said, and there was something in her voice that was not quite humor but was adjacent to it. I mean it literally. Clean floors, controlled environment, equipment that gets sterilized. After 8 years of operating in conditions that were none of those things, I wanted to be somewhere that was. She paused. I also needed to be somewhere that wasn't on fire. I mean that both literally and otherwise. You were Special Forces medical, he said. Yes, you performed surgeries in the field. When there was no other option, frequently. She picked up the next instrument. It wasn't surgery the way it's surgery here. It was emergency stabilization in non-permissive environments. The goal was to keep someone alive long enough to get them somewhere with an actual OR. Sometimes you succeeded. Sometimes the OR was 4 hours away by helicopter and the weather was wrong and you did not succeed. She said the last part without drama, without the heaviness that people usually put around statements like that. As a fact that had been lived with long enough to stop requiring a particular tone. Yesterday, Stokes said. Yes, she said. You placed that clamp with your non-dominant hand, he said. She looked at him steadily. My dominant hand was controlling the field. It was the better option. In a hospital setting, that is technically outs my scope of practice, she said. Yes, I know. She held his gills. Frank Dempsey has a granddaughter who turned 2 years old last month. I saw the photo on his intake form, the little ones in the firefighter hats. He was going to bleed out in the time it would have taken to escalate through the appropriate channels. Dr. Stokes. I made a decision. He was quiet for a moment. You didn't tell anyone, he said, about your background. When you were hired. The file is available to anyone who requests it, she said. Nobody requested it. Something shifted slightly in the room. Not the air, not the temperature, but something in the quality of the silence between them. You could be a PA, he said. With your training, your field hours, you'd qualify for an accelerated bridge program. You could be in a surgical residency within. I've been offered those paths, she said. Twice. I declined. Why? She set down the instrument she was holding and turned to face him fully. When I came back, she said. I spent 6 months not being able to sleep past 0400. I spent another 3 months where I could not be in a room with more than 12 people without running a threat assessment. I had been in environments where every decision I made had a direct and immediate relationship to whether someone lived or died. And I was good at those decisions, and those decisions cost me things. I am not going to enumerate it for you in an instrument room. She said it plainly, the way she said everything. I came here to do work that mattered without carrying everything that the other work cost. I came here to take care of people in a building that doesn't have holes in the wall. I didn't come here to run a department. I came here to be useful in a way that lets me also be intact. Stokes listened to this without interrupting, which was notable because he was not, as a general rule, a man who listened to things without interrupting. You guided me back into that procedure, he said. You're a good surgeon, she said simply. You froze for 3 seconds, it happens. The rest of the procedure was yours. I just made sure you could get there. He absorbed this. You made it look like it was mine, he said. Because it was, she said. You closed Frank Dempsey. I moved a clamp. He studied her face for a long moment. There was nothing in her expression that was asking for anything. No calculation, no positioning, no reading of the room for the response she wanted from him. She had simply told him the truth in the most direct terms available, and she was now waiting, with the patience of someone who had once waited 17 years in a hindsight for a situation to resolve, to see what he intended to do with it. There's going to be an incident report, he said. About the clamp. I know, she said. I'll need to note what happened, I know. What I put in that report matters, he said. For you. She looked at him. Write what happened, Dr. Stokes. I did what I did. If there are professional consequences, I'll navigate them. He nodded once. Then he said, Mrs. Gruber in room 318 has been on the same anticoagulation protocol for 11 days. I looked at her chart this morning. Something isn't sitting right with me, but I haven't been able to identify it. The hematology consult said she's within normal parameters. Nora was quiet for a moment. Her chart is on the system, she said. Yes. Another moment. Then, she was admitted with a right hip replacement? Yes. And she's been immobile since day 3 because of pain management concerns. Yes. Has anyone run a lower extremity ultrasound in the last 48 hours? Stokes was still. Her D-dimer has been trending up, Nora said. I saw it when I was cross-referencing the OR pre-op notes last week. I flagged it to the floor nurse. I don't know if it went further. It didn't, Stokes said quietly. She needs a DVT workup, Nora said. Today, not tomorrow. He looked at her for a long moment. Come with me, he said. She almost said something that would have been a deflection. She could see it, the shape of the professional refusal. Technically this is outside my area. I'll let the team know through proper channels. She had said versions of those things before. She was good at disappearing back into the procedural structure, at keeping the curtain where it needed to be. But she thought about Mrs. Gruber in 318, who had told Nora 3 days ago that her left calf felt heavy, which Nora had documented and passed up the chain and which had apparently stopped somewhere before it reached anyone with the authority to order judging. All right, she said. She set down the instrument. She stripped off her processing gloves. She followed Raymond Stokes out of the instrument room and down the hall toward 3E. And if any of the staff they passed in the corridor thought it was unusual to see the chief of hepatobiliary surgery walking side by side with a scrub tech, as if she were a colleague he was consulting, they thought it quietly and kept it to themselves. Mrs. Gruber had a DVT, a significant one, sitting in the left popliteal vein and extending upward, exactly where Nora had thought it might be. The imaging was ordered within the hour, the anticoagulation protocol adjusted by end of shift. The attending who had been managing her case came by later that afternoon. After being briefed by Stokes, with an expression that moved through several emotions in quick succession, before settling on something that looked like professional recalibration. Nobody asked Nora directly what had happened. Nobody needed to. The incident report from the OR was filed the following day. Stokes wrote it himself, which was his right as the attending of record, and he wrote it carefully. He described what had occurred, without minimization and without embellishment. He noted that a sterile field intervention had been performed by a non-physician team member under conditions of acute surgical emergency, in which delay would have resulted in patient death. He noted that the intervention was technically correct, that it preserved the patient's hemodynamic stability, and that the subsequent repair was completed without complication. He submitted a concurrent request to the hospital's credentialing committee, asking that Nora Voss's military training and field experience be reviewed for recognition under the hospital's advanced clinical specialist pathway. He had not told Nora he was going to do that second part. He suspected she would have asked him not to. He was correct. She found out 2 days later when the credentialing office sent her a notice that her file was under review. And she stood at the locker bank on the 3rd floor for about 30 seconds. Later, before he folded it and put it in her pocket and went back to work. She was not angry. She understood what Stokes had done and why he had done it. And she understood that it came from something real, rather than from the impulse to manage her career on her behalf. It came from a man who had been stopped by something he didn't understand, and had chosen to stand still long enough to see it clearly rather than move around it. That mattered. It didn't mean she wanted it, but it mattered. 3 months later, the credentialing committee completed its review. They brought in a military clinical liaison from the Department of Veterans Affairs, and a representative from the State Board of Surgical Technology, and 2 consultants who specialized in alternative licensure pathways for veterans with advanced medical training. The review took 11 days. The outcome was a new classification that Harwell Regional had not previously had on its books. Advanced Clinical Surgical Specialist, with a scope of practice that reflected what Nora Voss actually was rather than the closest available box from the existing organizational chart. She was told on a Wednesday morning by the credentialing committee chair, in a meeting that lasted 8 minutes, because that was how long it took to explain the decision, and hand her the documentation. She said, "Thank you." She asked whether it changed her reporting structure. It did slightly. She asked 2 clarifying questions about the scope of the new classification. They were answered. She folded the documentation the same way she had folded the review notice, put it in her pocket and went back to the OR. Frank Dempsey came by the hospital the following week. Not as a patient but on foot, in his regular clothes, moving a little carefully around the surgical site but moving. He had brought his daughter and his 2 youngest grandchildren. The 9-year-old girl, whose name was Lily, had made something at school. It was a drawing, large format construction paper, executed in the decisive lines of a child who was not yet self-conscious about art. It showed a woman in green scrubs, standing very straight with her arms slightly extended. The woman in the drawing had wings. Lily had given the wings a lot of attention. They spread from the woman's shoulders across nearly the full width of the paper. Careful, detailed, almost architectural, as if the child had thought hard about what wings that were real and functional and built to carry weight should actually look like. Nora received the drawing in the hallway outside the family waiting area. She crouched down to Lily's level to look at it properly, which is the right way to receive something a child has made. She asked Lily about the wings, the specific question about how Lily had decided on the shape. Lily thought about it with the seriousness that 9-year-olds bring to important questions. They had to be strong ones, she said. Because you hold people up. Nora was quiet for a moment. That's exactly right, she said. She taped the drawing to the inside of her locker door that afternoon. It was the only thing on the door. She had worked at Harwell Regional for 3 years and 4 months, and she had never put anything up before. Every morning, before her shift began, she opened the locker to get her badge and her ID, and the small notebook she kept for patient observations. And she saw the wings and she went back to work. That was all she had ever wanted to do. The work in a building with clean floors and equipment that functioned and monitors that told you the truth. With enough quiet around her that she could do it well, and enough structure that she could rest between times, and the knowledge which she carried privately, and did not require anyone else to confirm. That when the moment came, and the room went wrong, and the people who were supposed to hold steady did not, she would still be there. She would always still be there.